So we're going to talk about this idea that an ambit is actually a sphere of influence. And we're going to think briefly about the relationship between worker and client, who in one sense, particularly in the sense of how they're able to understand each other's minds, are both best understood as partially sighted. So in the therapeutic encounter, the coming to know each other, both have perhaps rather a small overlap in what we would call partially shared, implicit intentions. What we mean by that is that they may hold ideas about what is the point of this relationship and why I'm embarking in this relationship and what I want to get out of it, that are not necessarily clear to each other. Over the course of their therapeutic relationship, one of the explicit aims in AMBIT as a way of working is the deepening of this relationship, particularly by beginning to expand the amount of our intentions that we're able to broadcast explicitly, to say them in forms of speech, to write them in forms of letters to each other or diagrams that we can draw, but to become more explicit in our intentionality in this relationship. And it's only when both sets of intentions for this relationship and this work are explicit that we can begin to map and hopefully expand the area of overlap, which in a sense is what your ambit as a worker is, the area where you certainly can expect and hope to have influence in the young person's life, is those areas where you have a shared, explicit intentionality. And it's the movement towards that that is particularly important in